PCOS means you can't get pregnant.
PCOS is number one factor for infertility.
You run an IVF center. So, what are the biggest emotional and physical challenges your patients face?
People who are desirous of a baby and they're not able to have one, that is something you can't understand until you are in those shoes. But at times the family doesn't support. They're not ready to own it up. There is abuse happening in the family, especially when it is a male factor.
Yeah. What is gynecological aesthetics? Can you make it pretty?
Indians have this thing about fairness. So we do surgical, non-surgical, aesthetic gynae. I tell them, you bring a reference picture. Most of the times, the demand is unreasonable. So there are still men who feel that, the woman should bleed on the first night.
Oh my God, really? What's the weirdest question you've been asked as a gynecologist?
कि आप केमिकल से बच्चे बनाते हैं?
God. You don't need a gynecologist until you're married or pregnant.
You require a gynec because you're born a girl, you're going to require
a
her.
gynec. Welcome to the Science of Beauty and Wellness by Dr. Anjali Hooda, where real stories meet with real science and health is not limited to diet charts and creams. Being an internal medicine doctor and then going into functional medicine later, I realized that being holistic and giving a holistic approach to the body and to healing is the most important way to look at health in the future. In this series, we sit down with bold voices, the change makers, from pilots to actors, fitness leaders to wellness pioneers, with their inspiring stories on health and wellness and discipline. This is your space to learn, reflect, and glow from inside out. Welcome to the Science of Beauty and Wellness. And today we have a special guest with us. She is a OBGYN, infertility specialist, and also an aesthetic gynecologist, which is something that is really we don't see so much in our profession. And she supports women through every phase of life, whether it is adolescence or whether it is motherhood or postmenopausal. So this is who I'm talking about is Dr. Yukti Wadhawan, and she has made her brand Yukti IVF, and she is really making changes in the world of women, right, and motherhood. And I welcome you, Yukti, today to this podcast.
Thank you so much, Dr. Anjali. It's always so, such a bright feeling to see you.
Likewise.
Yeah.
So today we'll be talking about a lot of things about women. Infertility, we know that, she's a specialist of that. But today we will specially be touching aesthetic gynecology, which will be towards the later part of the podcast. So you'll have to watch the entire thing to get to that. right? That is something, a big area of interest for me also.
Yes.
How did you get to this? Like, give us a snapshot of your little journey till now.
So I think ever since I've been knowing the field of education, so ever since we were in school, I always wanted to be a doctor. And per se, my journey as a gynecologist, I think I was meant to be there. I was always a very strong woman, strong in the sense I cherished my womanhood, the essence of my being a woman. So, I always had that feeling that I have to make a change. I have to bring a change in every woman I meet in her life. So I think being a gynec is the most gratifying way of doing that. And I think I'm doing my best.
Wonderful. Really, really wonderful. And so what are the most common hormonal issues that you see in your practice?
See, women means everything is about hormones, They are going haywire at every step of a woman's life. So, the moment she attains menarche, an adolescent girl, she attains menarche. So the hormonal changes happen. It's the body shape, the curves, those change. It's the skin that changes. It's the hair that changes, the voice that changes. So everything in a woman's body is about hormones. And in today's times, when we are all into career, I don't know how many of us do actually get time to sleep well, to eat well, to exercise well, to look after ourselves. So, all these things are going to impact the hormones. So, hormonal imbalance is the most commonest thing that we see in our OPDs. Every other patient who comes to us is coming with some or the other imbalance in hormones, be it PCOD, be it
Yeah.
endometriosis,
Right.
fibroids, but it's all,
All hormonal, right? Yeah.
everything about that.
So, of course, stress is affecting a
Too
lot,
much.
right? I see a
Yeah.
lot of early menopause. Even
Yeah, very,
in my
very
practice.
truly.
So it must be
Yes.
like
Yes.
stress, I think, is it? Or the
The
life
biggest,
in general?
yes, the biggest factor is stress, but we have a lot of smokers these days, and smoking really, really impacts your health, be it your fertility, be it a general hormonal imbalance, or be it premature menopause.
Really?
Yeah, it's impacting to a
But
greater
what do you say
extent.
to sitting is the new smoking also?
I keep telling my patients that, don't smoke. You can do other things in life, right? To make yourself feel better, but don't smoke. Because as a fertility practitioner, also, I'm telling you, it really impacts.
What about alcohol?
Alcohol? Still, it's not impacting that badly, Yeah. Because what happens is with smoking, the cilia in the fallopian tubes gets haywire, right? So the movement of the egg in the fallopian tube, and then when it fertilizes, further movement as an embryo is hampered because there is no ciliary movement. The embryo or the egg would not move forward in the uterine cavity. So the fertility issues happen, and more chances of ectopic pregnancy happen. Yeah. So smoking is more harmful. See, anything in excess is bad.
Yeah, of
Even
course.
alcohol.
Yeah.
In moderation, it's still okay.
Yeah, definitely.
But smoking is no good.
Not a good. What advice do you have for young women starting contraceptives or hormone contraceptive for irregular periods?
See, there is no harm as it is. Hormonal contraceptives have various purpose. They can be for the contraception. They can be to regularize your cycle. They can be to balance your imbalanced hormones. So at various times, we prescribe hormones to the girl. And it's a common notion, like when we prescribe to the younger girls, maybe in their 20s. So usually the mothers say, oh no, we don't want the hormonal pill. They're going to do no good to her. That is not so. It is not for a long term. It is safe. We prefer the low dose pills for those girls just to balance her cycles and treat the problem that is occurring due to the hormonal imbalance.
I think, like, even I see patients who come with they're taking the OCPs and stuff. I mean, I generally tell them, take it for a small time. Don't do it like for a long time.
Absolutely.
Yeah.
We just give a short course, maybe 4 to 6 months,
Yeah.
and then stop. And then, actually, the most commonest problem we see in the younger women is PCOD.
Yes.
Right.
Of course.
I'm sure
very,
you
very
see
big
that.
problem. Yeah.
It's like almost 70% of the OPD these days is a PCO patient. No matter
Why?
what
is
age group.
happening? Because of all this we discussed?
Yeah, because of the lifestyle. Major factor is lifestyle. The girls, even the college girls, the young, women who are into jobs or maybe shifting cities, for work. So everybody has a bad lifestyle. They're all into junk.
Junk food is a very
No
big
balanced
problem.
diet.
Yeah.
No exercise. They're
And this
working
cold coffee business also. Like, this is the
and they're
worst
working
thing.
crazy hours. Some people have the night shifts. So actually, you're a doctor, you understand the circadian rhythm goes haywire. So eventually, if you're not having adequate sleep, that is also impacting your hormones. And once the hormones are impacted, the metabolism is impacted, they're going to gain weight. And once the weight gain is occurring, it's like a vicious cycle. All the more they're going to become lazy. So they don't want to wake up and do some exercise. So it's not getting corrected on its own. And this is what is the commonest problem. I think junk food and to some extent, even the OTT. People are so glued to their televisions. All the time they're hooked on. They don't want to go out, do something good for themselves, as in physical activity. So I think that is a major factor.
So some myths that I would like to address, on this channel. PCOS means you can't get pregnant. True or false?
No, not at all. It's not so. PCOS also are, they range from mild, moderate to severe PCOS. when it is mild, people do conceive naturally. They might just not know they are PCO patients, and they might just get pregnant on their own. But yes, PCOS is the number one factor for infertility. But that doesn't mean that all PCOS don't
Will not.
conceive.
Okay.
Yeah.
You don't need a gynecologist until you're married or pregnant.
Oh, talk about it. These days, all the younger girls, they start from 13 and they are so confident. They'll just come on their own. They want to visit you. They even want to inquire about things, which is such a good thing.
Yeah.
Yeah.
Very, very good.
Yeah.
things.
So you require a gynec, because you're born a girl, you're going to require
Why a
her.
gyneco forever. Skipping periods with birth control pills is harmful.
Not really.
Not really.
It's about regulating your hormones and balancing them so that you get your periods regularly. So it is not doing any harm to you per
Okay.
se. Yeah.
That's okay. If your thyroid is normal, your hormones are fine.
Thyroid is not the only hormone that matters.
That's a bad myth. We should.
Yeah, it's just one of the hormone.
Yeah.
And definitely hypothyroidism is a very common thing, but not the only thing that matters.
So now we're going to talk about fertility, IVF,
Yeah.
and you run an IVF center.
Yeah.
So what are the biggest emotional and physical challenges your patients face?
Too many. It's the emotional draining that happens.
Yeah.
When the couple is going through this phase, they need your support as a doctor. They need the family support. They need their partner support. They require a lot of it, because see, the people who are desirous of a baby and they're not able to have one, that is something you can't understand until you are in those shoes. So as a fertility specialist, the biggest thing I tell my staff, I tell my junior doctors, you have to empathize. You have to understand the patient, the want, the desire. They want to be parents. It's such a beautiful feeling. I mean, at times, Dr. Anjali, people are ready to give away anything.
I know. I have
That-
had
yeah.
such patients. Yeah.
So there are people who come and say, Doc, whatever it takes, we're ready to give to you. Just give me a baby. At times, you feel very helpless also, knowing their condition, knowing the problem they have. And then, you have very little to do at times.
Right.
So it's really it's a very different phase for us also. And I think we've grown in it. We are also evolving in it.
Right.
But you have to be a very different person to deal with them. Very patient to listen. And at times, these are little things which lead to marital discord. There is abuse happening in the family from
right.
all angles. Maybe, the family is not supportive, or they're not able to understand that there is a problem.
Yeah.
Whether it is a man or a woman who has a problem, but at times the family doesn't support.
Yep.
They're not ready to own it up. And especially when it is a male factor.
Yeah. When there is a man who's
the family
not
doesn't
able to
own
make
up
a woman
that
pregnant.
easily.
Yeah.
It's a very sensitive branch, I would say. Yeah.
I think it is very sensitive. What should couples know before they consider IVF or IUI?
See, there are some basic investigations which we tell the first time the couple visits us. So we give them a set of standard, minimal, basic investigations for the man and the woman both. No matter what, no matter the man says, that maybe it's the second marriage and I've had a child before, or maybe I was dating a girlfriend and she got pregnant before. No matter what,
Still, you would
we
want a
would
semen
still
analysis.
want to. Yes, the semen analysis, semen culture is very important, and in today's time, diabetes workup is very important.
Yeah.
And lipids too. So that is my routine for the man as well. For the woman, it's the basic hormones, the serum FSH, LH, E2, AMH, and thyroid profile, prolactin, and the sugar profile. That's very, very important. So basic set of investigations for both of them. And then we tell them that, you have to be realistic as to what age you are in. So for instance, if we have a younger couple, less than 30 years. So if they are visiting me, I would probably just tell them that, if your hormones are okay, everything is okay, please go ahead and try naturally. I'll probably counsel them for the fertile period.
Yeah, the
that this is the
ovulation.
time you are ovulating, and just relax, don't stress out. So I'll tell you what I tell my patients: don't think कि big boss चाहते हैं आज आपको ये task करना है. Don't make the
I think
process
the big
of
boss would have.
baby making.
Right.
You actually have to be making love. Just be in the act and try naturally for a year or so. If you are not able to conceive, then come back. But if people, the commoner age group these days is 35 plus, there you don't have that window to try. So we give them 6 months. If you've tried for 6 months, no success, then we'll investigate further. We'll investigate your tubes, we'll see if the ovulation is happening or not, and then we'll move ahead as to what should be done.
Are there any early lifestyle changes in women that they can do?
Yeah, definitely. Everybody, no matter what, no matter you want a baby, you're thinking about fertility, or you're thinking about your skin, your wellness, lifestyle is the first thing a woman should incorporate in her routines. That adds to a balanced diet, adding, a lot of nuts, fruits, water, hydrating themselves is very important. So that has to be done. And some amount of exercise has to be incorporated. As simple as brisk walking. But it has to be done. And also,
Very basic things, basically.
yeah,
na?
basic things. And also, Dr. Anjali, I keep telling my patients, do meditate.
Yes, that goes in my prescription also.
Please meditate, even if it is 5 minutes. Even if you're not able to focus, or some people say that, I'm not able to meditate for long, I'm not able to focus on something. I keep telling them, chant. Whichever religion, whatever you follow, chant. It relaxes. Your, body, mind, and soul axis has to be aligned. So that is something, it has to be in the daily routine, in a prescription form. And I think that's what matters the most.
There is still a lot of stigma around the infertility, right?
Yeah.
So, what do you want to tell people who are suffering silently?
Do not suffer. See, I'll tell you, Delhi, still things are better now. I mean, I think in all the metro cities, it is much better.
Yes.
But the moment you just go a little away to maybe tier 2, tier 3 cities, situation is not the same. There still are stigmas.
There's
there
still
are
a lot of
taboos,
stigmas. Huh?
because a lot of people think that this is not going to be a natural baby. I'll tell you, one of the patients
Yeah, how
told me
funny is that?
कि आप केमिकल से बच्चे बनाते हैं.
God.
I was like, it took me a while to understand chemical se bache. That is the notion people are carrying.
Yeah.
So this is a message to everybody whosoever is watching the podcast. बच्चे एक ही तरह से biologically बनते हैं with the man's sperm and with the woman's egg. There is no other way. It is not like a teddy bear factory that we have, जिसमें वो conveyor belt पे stuffed toys बन के आएंगे और बच्चे आ जाएंगे. ऐसा नहीं है. They are only made one way. It is just हम कोई भी procedure जब करते हैं, जब हम IUI या IVF करते हैं, so we help. We take out the gametes, we take out the egg, we take out the sperm. हम उनको एक environment में, test tube में, petri dish में, we make the babies out of it, put it back in the woman's womb. So वापस से इम्प्लांट कर दिया जाता है. प्रेग्नेंट जो होती है वो लेडी ही होती है. नॉर्मल प्रोसेस होता है. कोई फर्क नहीं होता एक IVF, IUI और एक नेचुरल बच्चे में. The process is the same, the pregnancy is the same, the complications are the same. It's no different. And there is nothing else that we do there. So I think that people have to understand that you don't have to suffer. You have to come out, discuss. At times, maybe we go to a little, some segment of Haryana or Punjab. So patients do come to us. They'll say that, ma'am, we don't want to get it done in our city, though there are IVF centers everywhere these days. But the lab, the environment, the process, the way we deal with the patient also matters.
I've seen your setup. It's quite, it's very, very upmarket and very like meeting all the standards of international.
We have really put an effort to that, because you have to have something different, and you have to have uh, you know to have a confidence on myself to be able to provide success in whatever I'm doing. You have to do that. You just can't compromise on the environment, the IVF lab environment and the setup environment, because ultimately you are creating a life. You have to feel that. So
Yeah.
you
No,
you
it
have
can't
to
be a
be able to.
mechanical way,
Absolutely. And then the environment, the emotional thing also that runs in your place has to have that vibe, the feeling.
Everybody in your staff has to be that
Yeah,
empathizing, right?
because all of us, just imagine a patient when they come and with whatever cycle, whether it's IUI or IVF, they start with us. It's like a month-long process. We are also equally involved at all levels. It's like our baby also, because
And
we
not
also,
everybody does that, Dr. Yukti.
yeah,
Not
we
everybody.
treat them like family, and at times they come and discuss so many things with you which probably they would not even have discussed with their own mother, because they feel safe, they feel they can take it out. And I tell them, please de-stress yourself, speak out your heart, and it's okay, take time, maybe 2-3 visits, but talk it out, so that you are at ease, you are calm, and so that whatever process we are doing, that materializes, and eventually you get
Yeah.
a baby.
No, it's very important for that calmness. To have seen people go through
Yeah.
unsuccessful IVFs. Let's see patient situations.
Okay.
Okay. A young woman walks in with cystic acne,
Mhm.
missed periods, and sudden weight gain. How would you approach this?
Typical picture of PCO, right? I think everybody these days can Google and AI,
Yeah,
and
yeah,
they
yeah.
know it. It's
Yeah, yeah.
PCO. Yeah, so that's a typical picture. Hormonal imbalance, most likely PCOD. So the first thing I would tell her is, don't just limit yourself to either lifestyle or medication or skincare. It all has to
Has to
come
come
together.
together. I
It
agree.
is a holistic approach that
It
has to
is.
be taken.
Totally. Very,
Yeah.
very, 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 very well said. New mom is facing postpartum hair loss, mood swings, energy crashes. What should she be testing for or checking for?
A lot of things. First and foremost, postpartum depression.
That's where I wanted to strike the
Yeah.
thing. Yeah.
It's very common, very underreported. So many women go through this. And
How do you say, like, let's say our audience is watching. What do you think a woman should look out for when we say postpartum depression?
okay, so post delivery, there are so many changes that happen in her body. Suddenly, everything is changing for her. It's the baby. She's changing diapers all night. She's not able to sleep. She's not able to eat well. She's breastfeeding the baby, so whenever the baby cries, they're breastfeeding, so it's her own routine is getting hampered. And if there is a cesarean section, so she has pain, she has discomfort, and the bodily changes that have occurred, maybe stretch marks, weight gain, changes in the breast, and pigmentations. So at times, the woman doesn't feel herself when she looks into the mirror, right? Hair fall, hair thinning, you just mentioned. So she is going through a lot. And if the support is not there from the family, there is no way out that she will not fall into that depressive factor. Not just the partner, the people around, maybe the mother or the mother-in-law or somebody who's helping her, or maybe a nanny. Everybody has to just take care of her,
Yeah.
because she's going through a lot of
Yeah,
change.
that is not done enough, I think.
Yeah, that is not.
No, not done enough.
Even in the urban
Hmm.
setups,
Huh.
in the best of the families,
Huh.
people lack that compassion towards her, that, oh, she's going through a lot of change, just give her some time, give her some time to
वो
accept
compassion है ही नहीं.
herself.
वो कई तो some people are having kids so frequently that compassion तो रहता ही नहीं है. You know?
Yeah,
तो
blessed are those
yeah,
people.
blessed are those people. And तो फिर वो सोचते हैं चलो कोई नहीं, she'll deal with it. And some women who are
Yeah.
strong generally, like career women, when they are going through this, everybody thinks they can be handling it, but it's a very
No.
delicate situation
Yes.
to be in,
Yes,
actually.
yes.
Yeah.
Because there is so much of hormonal change again happening in her body, which is not that evident to people and they don't understand. So I really feel that that is a time when she needs extra dose of love.
What's the weirdest, funniest, or more unexpected question you've been asked as a gynecologist?
I can write a book on this, probably. Funny questions.
You should write a book.
Yeah. I think I will probably.
I wrote a
sometime.
book on patient scenarios, and I still feel I need to do more.
Yeah.
पर book तो लिखनी चाहिए.
I just told you, sometime back, chemical से बच्चा बनाते
बच्चा
हैं.
बनाते हैं.
Yeah. And
And you can write some funny stories, no?
yeah. So there are people who, in today's times, also, just, on Saturday, I had this patient who does not know that what is the process of childbirth. She really did not know that where is the baby going to come out from.
Oh, how old?
In today's times,
Yeah.
in a setup like Delhi, you still have people who don't know the
they're
process.
not educated? Not educated, maybe?
Very well educated.
Oh, but they teach in school. My kids know.
Both the husband and wife, they were unaware of the process.
Wow, that is the weirdest thing I've
So
ever
8
heard.
years of marriage
Hmm.
and non-consummated because they don't know the act.
Oh my God.
That is something which is actually, it's painful also because they're both suffering and they don't know that they're suffering.
Who to go to?
They don't know. So they were referred to me by a doctor in army, and they were coming from South India, from Puducherry. Imagine, nobody knows that. They said we were posted in Port Blair, and there was no doctor who could understand what is the problem. They were, whichever doctor they were going to was terming them as infertility couple.
Oh,
Without
without
realizing.
getting into the depth of what is going on.
Yeah, that is also a situation that occurs, and it isn't very.
That is the weirdest thing.
Yeah, weird, very weird, and especially in today's times when I think there is no barrier
there's
to
no
knowledge.
barrier to knowledge. Yeah, there's so much stuff going on everywhere. Do you recommend supplements to your patients
All the time.
Do you think probiotic is a good thing? Like, remember
Wonderful.
once Kim Kardashian had said something about probiotic for vaginal health?
Yes. So for vaginal health, we have separate pre-probiotics.
Oh, you do have?
Yes. And we do prescribe regularly.
Really?
Even patients who come with recurrent discharges, vaginal discharges, recurrent UTIs, recurrent itching. All these patients also we prescribe vaginal pre-probiotics. See,
are there brands which are saying we have vaginal pre and pro?
So many.
Oh, yeah? I didn't know that.
There's so many. Yeah. And trust me, they create a layer, a kind of, they build up your immunity in a way that you do not contract infection frequently. So I think that's the best thing. The way you take it for your gut health, you take it for your vaginal health.
Okay, that's interesting.
Yeah. So we have vaginal tablets which can be inserted vaginally also. But mostly the ones are available oral. But they're very, very effective. Very effective.
Really? That's very interesting.
Yeah. Many brands are available. And they're very good. And it's like a regular thing in my clinic. And per se for all aesthetic gynae procedures. So we prescribe them prior. So it's like a health supplement.
Yeah. I prescribe probiotics to almost everybody.
The way you give it for metabolic health.
Yeah, exactly. Very nice. What about D, omega-3 and all that? Obviously.
Yes, obviously. See, there is a strong association of PCOD with vitamin 3 deficiency as well. It's mentioned everywhere. And I haven't seen more than, 1 to 2% patients who visit who have an adequate amount of vitamin D. Everybody's deficient. Every single patient is
I've
deficient.
seen everybody's deficient in vitamin D.
So you have to. And the problem is, patients will take vitamin D weekly because everybody knows by this time. And then they leave.
They don't
No
even
matter-
go into maintenance.
Exactly.
Yeah.
No matter what the value was, no matter what is the build up, no matter what you have to further build on, nothing.
That's a very good thing you said, because people don't take vitamin D as like they don't do a maintenance when
They
they have
don't.
finished the mega doses. They
Yeah.
don't do maintenance. Yeah.
And yeah, another thing, whosoever is listening, calcium or vitamin D3 is two different things. It's such a big myth. कैल्शियम ले रहे हैं, हम दूध पी रहे हैं, तो फिर तो हो गया ना.
डी तो है ही नहीं.
Calcium is different, vitamin D3 is different. It has to be taken separately at different times in different forms. You can't combine both and take. It's a very important message.
वेरी इंपॉर्टेंट.
Yeah.
जो सुन रहा है सुन लो भाई, कैल्शियम और डी अलग अलग चीजें हैं.
Yes.
और खाने में डी नहीं होता है unless it's
Yeah.
fortified.
It's the only edible form or food form of vitamin D3 is egg yolk.
एग. और वो खाते नहीं लोग, फेंक देते
वो
हैं.
खाते नहीं है. All the gym people have said egg white खाओ. So 10 अंडे खा रहे हैं, but they will not take egg yolk. So vitamin D3 तो आप ले ही नहीं रहे. और धूप में कोई कितना जा रहा है, कब जा रहे हैं.
धूप में निकलने से तो डर लगता है काले हो जाएंगे.
And that too,
ये भी तो होता है.
early morning hours, so before 12 p.m,
हाँ.
if you go out and take that sunlight,
That is
rich
the
in
one,
vitamin
yeah.
D, not the
No,
other
that
ones.
that is other is UV now.
Yeah, others you.
Very very good point. That morning sun is better. जल्दी उठो.
जल्दी उठो.
पार्क में जाओ.
Yes.
So how do you manage your energy? You are full of energy. I've seen that. I've met you many times now. Like you're a doctor, entrepreneur. अपनी energy कैसे maintain करते?
I think my family plays a major role.
Really?
Yes.
Okay.
I think I get all my energy from my parents. And you know what, Dr. Anjali, I keep saying this to so many people. Have the feeling of gratitude at every moment of your life. I think when you live in that feeling of gratitude, you're grateful for every little thing that you have, the resources we have, the staff we have, the place we have, the family we have, the parents you have, your siblings, your friends, every single thing, every single person you have in your life, it just gives you a different energy. It's like kind of a boost for me.
Yeah.
That what if I was alone? What if nothing was there? So I think I owe it to my family. They are my biggest energy boost. So, at times when you have had a bad day at work and you're not feeling up to yourself, so ऐसे घर जाके लगता है क्या है ना life में ठीक नहीं. It happens with all of us.
Yeah.
We are also women. We have our hormones playing. So
Yeah.
And when I go back and I look at my parents and the joy they have on their face when they look at you, and the confidence ki, हम हैं ना, all okay. अरे don't worry, सब होता रहता है. I think I'm all done. I'm recharged and I'm all set for the next day. कि हाँ ठीक है, जो भी होगा देख लेंगे. Yeah, I think
that you're very fortunate, I must say. I hope everybody has that in their life.
There is always somebody, maybe a very close friend, who gives you that energy. But, this is also one thing very important to all the women. Choose the people you are with, you vibe with.
Yeah, you have to make your own tribe.
You have to pick your own tribe. So I think your girl power around you also gives you power. So
yes.
I have my bunch of friends and you one of them.
Oh my God, yes.
Oh, yeah.
The girls, the girl tribe, our groups are...
Gone are those days, when women were envying women.
Now we want to lift each other up. Yeah,
you have
that's
to
the best
uplift
part.
each other, appreciate each other, and empower each other. I think that has to be the message in bold for everybody.
Women should uplift each other, because we've had the whole era of putting us down.
Yeah.
And now it's time to shine.
Yeah, it's
definitely.
time to shine. You just have to spread your wings and fly and shine.
So, Dr. Yukti, very important question I want to ask you about, which I think the audience would be waiting for, is what is gynecological aesthetics?
Right. So, very commonly people talk about it as cosmetic gynecology or aesthetic gynecology. So, what I would want to tell you, it is not aesthetic or cosmetic, it is functional
Okay.
primarily.
Okay.
So, we call it AFR, that is aesthetic and functional and regenerative gynecology. Okay. So, what happens here is cosmetics से ना लोग सोचते हैं कि you will have a Barbie doll vagina or you can just have a makeover like the way we have face. It is not so. There are functional problems that happen. There is urinary incontinence that happens. There is vaginal dryness that happens. There is vaginal laxity that happens. It is wrinkled, pigmented vulva that occurs. So, all these things are functional issues which a woman faces. And this particularly is the area where attention has to be given now. This is the time we have to pay attention to that.
You know, let's say, give us a couple of scenarios where a patient can, of course, you've given us all the situations. Like when you, is it stupid to think that the vagina can look beautiful?
Not at all.
It can.
It can.
I mean, it is. I mean, I wouldn't say is there an ugly vagina? I don't know, but I'm just saying, can you make it pretty?
So, there is nothing like an ugly vagina or an ugly vulva. Anything that you feel confident about is your normal,
I love that.
right?
Perfect.
There is no perfect picture. We don't have like a reference picture so as to this is fine and this is not. No.
Everybody's born with different stuff.
Everybody's born differently. Everybody's vulva will look different. As long as it is not impacting your sexual health, it is not impacting your emotional or mental health, it is not lowering your confidence, I think everything is okay. So, whatever you're happy with, you're comfortable with your own genitalia, with your own self when you look into the mirror, or when you're in the act of, love making, that's fine. But anything that you feel is not okay, you're not feeling confident, it's hampering your sexual life, you're feeling incapacitated in front of your partner, please do get yourself checked, do look into it, whatever it takes to make it look better, please do that. So what I tell my patients when they come for so we do surgical, non-surgical aesthetic gynae, I tell them, you bring a reference picture from the internet as to what you want. Most of the times the demand is unreasonable.
Oh my God, really?
Like, for instance, they'll bring a picture of a Caucasian with the fair skin. And, Indians have this thing about fairness. And I don't know why, but they're so overwhelmed with fairness down there as well. They want it to be multi shades lighter. But you, as a doctor, as a provider, have to be very realistic in your approach in telling the patient, this is what can occur, this is not what is not possible. So that is also there. People have these things, and also, Dr. Anjali, it's something very, very realistic as to today's times. Women are getting married late, right? So probably the sexual debut happens much early. There is no correlation with marriage. So by the time at times they want to get married and settled, either the vagina is loose, it's lax, because it is genetic, definitely, and it is because you've been sexually active much prior.
Yeah.
Right? And when they want to get married, they want to feel that newness, the feeling they want on the first night. So at times that is also the demand of a patient. So
So
I
you can
cater to
do
it.
vaginal tightening.
Yes, we do cater to that because it is going to add to her happiness, her confidence. But here, I'll tell you, so I'm very particular in asking the patient, why are you getting this done? Is it you or is it the partner demand? Because then you're not meeting the standards whatsoever. So there are still men who feel that, the woman should bleed on the first night, whereas that is no, what should I
Yeah,
say?
no proof of virginity.
Yeah. So, but still, there are men who are like that. So you have to be very realistic in addressing to the demand as well. That why are you getting it done? If it's boosting your confidence, you're going to feel happier with your partner, you're going to have a better sex life, I'm all in. Another thing, people who are, probably they had a marital discord and they got separated. So women are taking second chances in their life at whatever age, in 50s, in 60s, when they are seeking a companion. You should never be judgmental as to does she need or does she not.
It's a need of a human being.
Yeah. And trust me, even a lot of gynecs I've seen, people like, अब क्या
अब क्या
जरूरत
जरूर
है?
हाँ हाँ बड़ा बैकवर्ड एटीट्यूड है कई
No,
लोगों
no. You can't be judging. Maybe it brings happiness to her. I'm saying that it is
It's a taboo to
she.
talk about it.
It is the woman. It's her happiness that's important. It is improving her quality of life, the way she feels. Probably, if she's having a happy life, she's gonna live a little more more years. So I think you should give it to her. At whatever age she's desirous of, whatever change, without judgment, be a decent, reasonable provider. Don't overpromise also. At times, people are commercial and they say, oh, yeah, we can do this, we can do that. No, you have to be realistic. There is tissue aging that's happening. Who knows it better than you? So there is collagen loss that's happening. There is skin aging. There is pigmentation that's happening. So whatever better you can give to her, please do that.
Very, very good. Very interesting, because I think vaginal beauty, or you can say, or vaginal, the way it looks and the way your
Yeah.
private parts look, it's nobody talks about that, and there are issues around it.
There are
Clearly,
too many issues.
yeah, there are.
People are more
issues.
aware these days.
Yeah, there are issues, and we should be openly able to talk that let's fix this.
And another thing, Dr. Anjali, I think I'm sure you also see a lot of patients, female sexual dysfunction. FSD is a very big bracket
There's
of
so much
patients.
loss of libido in women that I am surprised, because ever since I started taking that in my history, I see
Yeah.
that so common in women than men.
There is a statistics, it's all there on Google. Anybody can go and visit and see. 70% of sexually active women have never experienced an orgasm.
Yeah.
Imagine, we're all living in a world, and especially India is a very populated country. People don't know. There's so many women who are totally unaware. So anorgasmia is a very big problem. People don't even know what does it feel like.
So how does one address that? Let's say ki somebody comes to you with saying, I never had an orgasm, doesn't know what it is. Would you ask the patient first that, do you know what is
Yes.
orgasm?
Yes. There are different phases of orgasm. And these days, people who, this bracket of patients who visit, they're well read. They've Googled it all. So they know what is the issue. So recently, I had a girl, 29-year-old, married. She said, I only have a clitoral orgasm. It's just that, when you're rubbing on the clitoris, so stimulating that, and she just gets an orgasm. There is no penetration that's required. So she doesn't know what is the real orgasm that she would probably experience.
Oh, there is a difference.
Yeah. So clitoral orgasm, at times women get it when they have an overexposed clitoris. Maybe they have got a resection, a clitoral hood resection done, and it is not done properly. The clitoris becomes more enhanced. So it's like, it's getting stimulated even when people are wearing tight fit trousers.
Got it.
The rubbing, the
Yeah.
friction is
Yeah.
stimulating.
Okay.
So she's getting an orgasm, but there is no penetration that's happening. So the G spot probably is not that well developed. It is not that active. And that is why this is happening.
But do the women know that all women
yeah,
know that G spot?
Urban women do know this.
Urban women know the G spot.
Yeah. And when I examine them, so when we do a per vaginum examination, so we palpate and you can feel that, yes, you're not feeling the bulge. So probably, and once you're examining, once we're doing a TVS scan, so we're using a probe which is inserted in the vagina. So you ask her those leading questions then.
Got it.
Is she feeling the arousal? Is she feeling anything, any change? So most of the time it is not. So that is why a part of aesthetic gynae is, we give these orgasm shot injections.
Yeah, the O shots.
Yeah, the O shots.
Where are the O shots given? G spot?
No, G spot augmentation is different. Orgasmic shots are different. They are given laterally to the clitoris to enhance the, feeling of arousal. And we also
Is it
augment.
painful?
No, not at all. Not at all.
Really?
Yeah.
One would
You
think
just put numbing and, we just
Really?
injecting. Yes. And then we put some fillers or some PRF into the G spot to augment that. Yeah. And you feel the fullness and, she will notice a change for sure.
Yeah. Do you do the P shots also? No.
No,
Just
we
the O
don't.
shots.
Yeah.
P shots are penile shots.
Yeah, penile shots.
To
So
enhance
O shots also, we don't use the term. In India, we use them as K shots, the Kama Sutra shots.
Okay. Good
Yeah,
one.
that's a patented, so we
Very
don't,
good one.
yes.
What's one thing would you want women to stop feeling guilty about when it comes to health?
Mood changes. Don't feel guilty about your mood changes. You're going to have maybe an overreaction or an underreaction, in different phases of your cycle, in different phases of your life, because your hormones are playing all the games. So don't be guilty about that.
Very true. Very true. Hormones are playing all the games.
I've seen, especially the postmenopausal women. So there was this, a relative of mine who visited. She said, I don't know, मुझे ना इतना बुरा लगता है. 2 grown-up sons she has. बच्चे बाहर जाते हैं, मुझे इतनी anxiety हो जाती है. I start crying and then I, yell at them. I call them कि तुम अभी तक घर नहीं आए हो. And I was like, okay, relax. It's a natural change that's happened postmenopausal. It's the vasomotor symptoms she's having, the mood swings she's having. You just have to be compassionate, understand she is going through these symptoms. But she herself was worried about her reactions. कि मैंने पहले तो कभी बच्चों को ऐसा नहीं कहा था. A woman, it's so beautiful to understand a woman. When as an adolescent, she grows, so the changes that happen in her body, the curves she's developing, the fat deposits she'll have, the skin glow she'll have, the sudden awareness she would have about her femininity. Then once she's in her youth, she's blossoming.
Yeah.
She's glowing, she wants to look good, she wants all the attention from men around. That's how she is. Then the reproductive age, the desire to be a mother, the feeling, the warmth she wants to have with her baby and bringing up this life, caring, the attachment. It's so beautiful. And once the kids are grown up, they're on their own. So either, even teenage children are on their own, or either children are going abroad for studies. So that is the time she's also going through menopause. So poor lady, this is her time where she's sinking. She's going through so much. And there is no support there. Children aren't there. Husband is busy with his own thing. Everybody has a life. So I think you just have to understand this process. And you have to just be a patient listener and understand she's going through something which is very natural. You and me will also go through.
Yeah.
Every
Absolutely.
woman goes through. So you just have to be all ears and address to the problem she has. So for menopausal women also, this is, something comes from my heart. I've seen my mom, I've seen my aunts, I've seen my, elder friends around. Please just be supportive. the hot flashes, the vasomotor symptoms, the mood swings, vaginal dryness, mood irritability, all this is night sweats. It's very troublesome. You just have to understand she's going through change.
Do you give PHRT?
Not really, but yes, I do give HRT. Yeah, so these days we have much safer hormone replacement therapies, and I'm a credentialed Indian menopause practitioner. So we prescribe HRT, which is very, very safe. So earlier these notions were there, cardiac health ko affect karega, breast cancer cause karega.
I don't believe that.
Now the HRT, the hormone replacement therapy, is much more safer. So people can really, consult your gynec, consult somebody who's practicing a menopausal
The
clinic.
thing is that every gynec is very ready to give the HRT. That's why I get a lot of queries for PHRT, because I think gynecologists most of them are still in that notion that, oh, it's a bad thing for you.
Yeah.
No, it is a very personalized thing. It's case to case basis.
These
There are
days we
people
have,
with breast cancer, family history.
Absolutely.
So then you won't, but you can, I think.
And another thing, which is very important for a woman throughout her lifetime, please take care of your bone health.
Yeah, estrogen depletion is a major cause of osteoporosis. Right?
So much. I mean, even, postpartum. So we do make it a point to give them calcium for at least 6 months postpartum. Not many people take it. They'll probably take it for a month or so and then leave. But they have to understand your bones are yours, everything. It's your structure. And they're going to give way. So this is your time to strengthen them, to take care of them. It's very, very important for women to take care of their bones.
Well, I think, Dr. Yukti, this has been a wonderful session of how much compassion as a OBGYN you have for patients and what you can do to change their lives. From, what I said in the beginning, from adolescence to motherhood to postmenopause. So you've touched every part of their lives, and thank you so much. And is there any question that you would like to ask me?
Of course. So I would want to know your mantra to a healthy skin. I mean, the way you are, fabulous. You just are defying all age standards. So what do you do?
I was laughing the other day, telling someone, oh, I still have follicles. Remember? I could become a mom again. But no, well, thank you for complimenting my skin. I think it's a whole thing that you have to do, like work out, good eating. I really don't eat junk. And really don't eat junk. I have to think twice before I eat a samosa or a burger. Like, it just gives me a current. Nahi, ye nahi khana, I don't eat junk. I, of course, drink lots of water. And I do have little abs, which I will not share here. But on the whole, I think it's the sleep, water, and exercise and food. 3-4 things. And stress kiski life mein nahi hai.
Skincare.
Skincare mein, skincare very important. Yeah, I do use I do the basic mantra of wash, tone, moisturize, sunscreen in the morning. Evening, wash, tone, moisturize, and night cream. And I do use retinol maybe twice or thrice a week. And depends. I use light retinol because my skin starts shedding starts flaking fast. Yeah, and then I do medical facials. I don't do the regular parlor facials at all. Never let anyone touch my skin. Bas, yeah.
So I think that's also another take which we would want our audience to take, that gone are the days and the era for salon facials. Now it's all about medifacials.
Constant massaging is not needed. It actually is bad.
Bad. Yes.
Yeah, it's actually bad because it changes the anatomy of your face. Yeah. And unless somebody's doing a lymphatic drainage, but they're not doing lymphatic drainage.
How many people do know the correct
No,
technique?
People don't know how to do lymphatic drainage.
No matter how many reels you scroll on Insta for face yoga and lymphatic drainage, but normal people aren't trained enough. So I think you should really agree to what she's saying. Eat well, sleep well, Take care of your skin. And another little tip, don't sleep with your makeup on.
Yeah, I never do
That
that.
really ages the skin.
Yeah.
So that's something I tell my patients. Whatsoever is the time when you go to bed, please deep cleanse your face and then sleep. Don't sleep with the makeup on. I think your skin, you don't do anything else and it's going to take you a very long way.
Yeah, I agree with that. I don't wear much makeup to begin with, so I always feel but still wash my
the
face. I
dust,
still
pollution.
wash, tone moisturize at night, and
Yeah.
then followed by a night cream, because I'm of course
Yes.
over 50. So of course you're over 50, you have to use
So you have to.
products.
True
You have
that.
to use. Yeah. Thank you so much for a wonderful, enlightening session today.
Pleasure.
हाँ,
Pleasure's all
मजा आ गया.
mine. Yeah, I know.
हाँ.
I really enjoyed it.